This is Mary Ray Ziegler. I am doing a heart and neck assessment for nursing 355. I'm going into my patient's room. I would wash my hands. Hi, Mr. Ziegler. I'm Mary Ray. I'm going to do a heart and neck assessment on you today. Do you have any history of heart disease?
No.
Do you have any questions?
No.
Okay. The first thing I'm going to ask him to do is I'm going to take my pen light and ask him to look to his left, and I'm going to observe for his carotid artery. And then if you would turn your head to me, observe for his carotid artery. I do not see it. It should not be visible at 45, 60, or 90 degrees unless the patient would be in some heart failure. Next thing I'm going to do is I'm going to auscultate and listen. I'm going to listen to your carotid arteries. I'm listening for any kind of bruit, abnormal. Would you turn your head, please? Would you hold your breath? Thank you. Turn your head to me. You can breathe. Now hold your breath again. I do not hear any swishing sounds. If I had heard some swishing sounds, it could be indicate maybe some narrowing or some carotid disease going on. Next thing I'm going to do is palpate his carotid arteries, and I am sure to palpate after auscultation due to the risk of causing maybe someone to vagal. So I'm going to take the pads of my fingers, index finger and my middle finger, and ask him to turn his head slightly to the left, and I'm going to palpate his carotid artery. I want smooth contour with no variations from beat to beat. And I'm going to feel both sides. Feel spongy. If I felt a thrill or an abnormal pulse, it may be, once again, some carotid disease. Now, next thing I'm going to do is observe his precordium. Look his chest area. I'm looking for any kind of abnormal pulsations. And I don't see anything. I'm going to take two fingers, my two pads of two fingers. I'm going to feel for his apical pulse. This would be at the 4th or 5th intercostal space, mid-clavicular. You may not be able to feel every one. You could ask the patient to reposition maybe on their left side if you could not feel it. Once I've done that, I'm going to do some auscultating and listening. I'm going to listen to your heart sounds. I'm going to do that at the apex of the heart. I'm going to count the rate rhythm. Should be between 60 and 100. Should be regular. Doing this for 1 minute. Listening for S1 and S2, which is the lub-dub. Once I'm completed that, I would listen for any kind of extra heart sounds. With the diaphragm and the bell, I would start with the aortic valve, which would be the second intercostal space right of the sternum. Then move straight across from that to the pulmonic area. Then down to the tricuspid, which would be 3rd to 4th intercostal space. And then mitral, 4th to 6th intercostal space. Then I would move to Erb's point. At that point, you should be able to hear all of the patient's heart sounds. And that completes my heart and neck assessment. Do you have any questions, Mr. Ziegler?
No.
Okay, I'm done with my assessment right now, and you let me know if you need anything. Thank you.
Thank you.